Epilepsy is a brain disease that has different causes, but it's characterized by the predisposition to having recurrent seizures. You can develop epilepsy at any age, from the time the child is born up to the time you're elderly, 90, you can develop epilepsy at any age actually. We have a lot of children actually suffering from epilepsy. So mostly in adults who develop epilepsy, you may actually find that there's a cause, maybe a structural lesion in the brain, maybe they had an infection, or they have a brain tumor, or they developed a stroke, or they had head trauma, they were involved in a road traffic accident and there was injury to the brain. But for children, they are what we call generalized epilepsies, which are mostly genetic. If somebody happened during embryogenesis, when the mother was pregnant, there was a gene mutation or something, so they tend to develop epilepsy. So we have a lot of childhood epilepsy. In adults, when they begin to develop epilepsy in adulthood, mostly there's a structural lesion that has caused that. 1 to 10% of the population tend to have at least one episode of a seizure in their lifetime without it being epilepsy. But for epilepsy itself is when they have 2 or more seizures that are 24 hours, more than 24 hours apart, and they are unprovoked. So only when somebody has a first seizure, then you determine their risk of them actually having epilepsy for you to make that diagnosis. Unfortunately, epilepsy has no cure, but it can be controlled. The seizures can be controlled. Studies have shown that up to 70% of the people with epilepsy have their seizures controlled with the appropriate medication, anti-seizure medication. And so when the seizures are controlled, they can live a normal life, have a career, get married, play sports. They can do anything that somebody else without epilepsy can do. The common myths that I've heard of, and I've actually heard from patients and their caregivers themselves. Number one, that epilepsy is contagious. So you find that when somebody is fitting, nobody wants to help that person. Everybody is scared of touching that person because they think they will get it. Epilepsy is a brain disease and it's not contagious at all. And the other thing which is very common is associating epilepsy with demonic possession or witchcraft. That is not true. So again, epilepsy is a brain disease. It's got to do with abnormal discharge in your brain. It's got nothing to do with that old grandma or old grandpa in the village who you think has bewitched you. So it's not associated with witchcraft or demonic possession.
I've had epilepsy all my life. According to what I know, I started having seizures when I was 1 month old, and then I had a break of about 11 months till I was 1 year old when I started to have repeated seizures. I was having like maybe over 20 seizures in one day every day.
There are some childhood epilepsies that we call self-limiting. When they're growing into adulthood, through adolescence, they reach teenagers, they just stop. That's the self-limiting. They just tend to stop. So those ones, if the child has that diagnosis of a self-limiting childhood epilepsy, we know they'll be on medication, but you expect them at a certain age, the seizures would have stopped.
I always used to find myself like maybe in hospital and things like that, but I didn't know why. Yeah, I didn't know why. Mom used to just tell me that no, it's because of the headaches, because I had really bad migraine headaches. And also I used to drink medicine every day, but I didn't know why I was taking the medicine. I only realized or found out that I was epileptic when I was 17 years old. And that was because I was in high school and then I had an argument with someone. I was so angry, yeah, and then I started convulsing. So when they took me to the school dispensary, the clinic, because I was in boarding school, the nurse had asked me if I have seizures. So I said, I don't have seizures. has anyone ever told you have seizures? I said, no. So then she said that, but you were convulsing and stuff like that. So I said that I don't know anything about that. Maybe we should ask my parents. And then from there, the rest is history. Yeah.
They can live a normal life. Unfortunately, some are limited because they are not on the appropriate anti-seizure medication, or they're not consistently taking their medication. But like I said, up to 70% the seizures can be controlled. Of course, there's the 30% that have drug-resistant epilepsy, and for those you have to consider other things like diet therapy, the ketogenic diet. Others, you have to do epilepsy surgery. For others, you have to do deep brain stimulation, which we actually don't do in our country. As long as the epilepsy is poorly controlled, then the outcomes are poor because you're always having seizures. It affects your ability to think. And each time you have seizures, you're actually at a risk of dying from those seizures. There's a medical emergency we call status epilepticus, where now you keep having recurrent seizures, you're not getting back to your baseline, and that becomes a medical emergency, and we need to treat that. So some, after they come to the hospital late, and then you find there's so much brain damage that has already occurred, and now this person becomes totally dependent on somebody taking care of them.
I think epilepsy has shaped my life in many, many ways. Yeah, so I realized that I'm capable of doing anything because of epilepsy. I didn't realize how strong I was till I had to live with this condition every day. I also didn't realize how much impact I can have on someone's life through advocacy and through spreading awareness. I didn't know. But I think without epilepsy, probably I wouldn't have achieved as much as I have, because I think it kind of it gave me the drive to pursue my dreams. Because I think with all the negative talk and the stigma, oh, people with epilepsy can do this, people with epilepsy can do that. And then I think within me, there was just that voice to say, oh, you have to show these people that you can do this. Like, they have a wrong impression, just so that they can see something different from what they are accustomed to.
For people out there, if you see somebody fitting, please help them, okay? So just make sure you remove anything harmful around them. Let the seizure episode run its course. Don't try and restrain them, because you're going to now cause fractures. Don't put anything in the mouth, because you choke them if they swallow whatever it is. So of course, sometimes they tend to bite their tongue when they are having the fit, but the tongue will heal. Don't put anything in their mouth. Just make sure they're breathing okay. If they have a tie, try to loosen it so that the breathing is okay. Put a cushion underneath their head so that they don't injure themselves in any way. And don't panic. Stay calm. Rush them to the hospital when the episode is done. My message of encouragement is seek professional health care, and you'll be given the right treatment to control your seizures, and then you can live a normal life. If you don't come, then you continue having seizures, you have neuronal damage, you have brain damage that ends up occurring to affect your ability to think. Eventually you are at a risk of death.